Right now, somewhere in your house, there's a small pill that can kill a bacterial infection in a matter of days. You probably don't think twice about taking it, but for 99% of human history, an infected cut was a death sentence, and nobody had any idea why. The story of medicine doesn't start in a hospital. It starts with humans eating dirt, chewing bark, and getting lucky. Let's go back roughly 60,000 years. In a cave in Iraq called Shanidar, archaeologists found a Neanderthal burial site surrounded by pollen from yarrow, chamomile, and other plants known today to have medicinal properties. For decades, this was cited as proof that Neanderthals held funeral rituals with flowers. But here's the twist. Those same plants have been used for centuries to treat wounds and fevers. It's possible this wasn't a burial ceremony at all. It might be evidence that Neanderthals already understood which plants could heal. That idea gets stronger the more you look. In 2012, researchers analyzed dental plaque from Neanderthal remains in Spain and found traces of chamomile and yarrow stuck in the teeth of individuals who weren't eating them for taste. Both plants are bitter. Nobody eats bitter plants for pleasure, which means somebody, thousands of generations before written history, had already figured out cause and effect. Eat this, feel less sick. So how does a species with no concept of germs figure out which plants help and which ones kill you? The answer is brutal trial and error, generation after generation. Someone eats a plant and gets violently ill. Someone else eats a different plant and the fever breaks. Survivors remember. That knowledge gets passed down, refined, and slowly built into something resembling a system. By around 2900 BCE, the ancient Egyptians had turned that trial and error into actual documentation. The Edwin Smith Papyrus, one of the oldest medical texts ever found, describes surgical procedures for treating wounds, setting fractures, and even performing basic diagnoses. And it's shockingly rational. No spells, no curses, just observation. If the patient's pulse feels like this, the injury is here. If the wound looks like this, here's what you do. This wasn't guesswork anymore. This was pattern recognition, written down so the next healer wouldn't have to start from zero. But not everything the ancients tried worked, and some of it was genuinely dangerous. Ancient Mesopotamian medical texts prescribed treatments involving animal dung for wound dressing, based on the logic that if something looked disgusting enough, it must be powerful enough to drive out disease. It's a reasonable-sounding theory. It's also how you get infections, not cure them. Medicine has always been part science, part superstition, and for thousands of years nobody could tell which was which. Then, around 400 BCE, a Greek physician named Hippocrates proposed something radical. Disease isn't a punishment from the gods. It's caused by natural physical factors, diet, environment, imbalance in the body. This sounds obvious now. At the time, it was revolutionary. For the first time, illness became something you could study rather than something you had to pray away. Centuries later, in the Islamic Golden Age, physicians like Ibn Sina compiled that knowledge into massive medical encyclopedias, cross-referencing symptoms, testing treatments systematically, and even developing early forms of clinical trials, testing one variable at a time to see what actually worked. This is where medicine starts looking recognizable, not folk remedy. Method. But the biggest leap didn't come from a doctor. It came from an accident. In 1928, a Scottish scientist named Alexander Fleming left a petri dish of bacteria uncovered while he went on vacation. When he came back, mold had grown in the dish, and strangely, the bacteria near the mold had died. Fleming almost threw the sample away. Instead, he looked closer. That mold was producing a substance that killed bacteria on contact. He'd just discovered penicillin, the first true antibiotic, sitting in a dirty petri dish he almost tossed in the trash. Before penicillin, a simple scratch could kill you. Childbirth was one of the leading causes of death for women, largely due to infection. Surgery was a gamble, not because doctors lacked skill, but because there was no way to stop bacteria once it got into the body. Penicillin changed the math entirely. Infections that killed millions became treatable in days. It's one of the reasons average human lifespan jumped dramatically in the 20th century. So here's the full picture. It started with a Neanderthal chewing bitter yarrow because it made the fever break. It became Egyptian scribes writing down what worked. It became a Greek physician insisting disease had causes, not curses. It became scholars building entire systems out of trial and observation. And it ended, or rather continued, with a scientist noticing something odd in a dish he forgot to clean. Every antibiotic in your medicine cabinet exists because someone, somewhere, paid attention to something the rest of us would have thrown away. We didn't discover medicine all at once. We stumbled toward it, one bitter plant, one dirty dish, one dead patient at a time.